did create this process, especially dealing with the mRNA and everything like that for the vaccinations, should definitely be recognized. But I guess a lot of people are curious as to, like, how could we develop a vaccination for, COVID? It wasn't quick, it took some time, but quicker, much more sooner than we would have any answers for any of these other things. Like, do you have any comment or perspective on that, if someone were to think along those lines?
Yeah, I would say, the only thing that was really expedited was the animal studies. So most of the time you'll do an animal study, and then after that, after you have your data from the animal studies, you start your human studies, your phase, 3 clinical trials. With these, the only thing that they did rush was they started the animal studies after they started the human studies. We had other animal studies, for mRNA, in animals, but specifically for COVID-19, we didn't have that. However, there was enough people who were very interested. I think this was just such a traumatic event for the whole world. Mm-hmm. It impacted the economy of, mm-hmm. so many countries. This impacted the world like we had never had, people that were, 60, 70 had never seen, in their lifetime. And so I think that
the last sweep was probably what the influenza pandemic that rushed across everywhere. Yeah,
exactly. So it had been 100 years,
mm-hmm.
Since we had a pandemic on this scale. And so I just think that it's important for people to be aware of that.
And the difference is we have heightened technology now. Back then they didn't have much. They were just, kind of getting by how they could back then with the sweep of that pandemic. So that would make this one even more traumatic because we have the technology and, medicine has advanced. So it's really like way worse if you think about it. So
exactly. And in that time, this virus spread way faster because of how globalized the whole country is. Mm-hmm. Before, it took, months for the virus passing around in the way that it did. Mm-hmm. Now it's like we travel so much, we'll go from one country to another in a day, and we'll do so much business meetings. And so the world is a lot more globalized. So this virus was able to spread way faster, affect, the economies and the death toll way faster. And all of that kind of put together, and all of the technology and everything that we have been able to learn from, really put all of the scientists working together. I mean, everybody mm-hmm. came together. I mean, we had lockdowns. We weren't doing much in terms of other things, so the scientists really put their heads together. These clinical trials came together. We had brave people who decided to enroll themselves in these clinical trials. And we had thousands. I mean, in each, the Moderna and Pfizer, we had over 30,000, I believe over 40,000 too, people who enroll themselves in each trial. They, mm-hmm. They did the right amount of timing. They measured it. They did all of the data. And so none of that was rushed. The reason it feels rushed is because we were in a rush, but the actual steps that it took for the human phase 3 trials were not rushed. Mm-hmm. And so I think it was great because when you have a disease that's very common, like COVID-19, like mm-hmm. when you have an infection rate, it makes it easier for you to collect data. If this was
Yeah.
like a rare disease, it would take years for you to find out, you know, okay, this person got this and this outcome, blah, blah, blah. But this was kind of perfect because many people were willing to be the first ones to have this vaccine tested on them. And so we really need to be grateful for the people who decided to enroll in the clinical trials. And we really need to also be aware that the reason we had, you know, fast outcomes is because how prevalent or how common this virus is in the whole world, that we were able to really collect data. Okay, like, you know, this virus ran rampant, like, in every continent, like,
and I
so
want to
it was good to connect data.
I want to interject really quick. Just, I think a lot of people may not also realize that, you know, I mean, I know it's a different story and it's COVID-19. I don't think it was the same thing, but I mean, COVID had been around before, you know what I mean? Years and years and years ago. So there were people who had similar, symptoms and things like that. Now, it was not like, it didn't sweep, you know, the countries the way that it did then. You know, you saw and you can read about these minor cases and, you know, maybe some of the treatments that they tried. And I know that they, I read like just a few studies from different, you know, physicians and just scientists who kind of like looked into it a little bit, but it wasn't like this. So they had something to go from. Now, this is a different strain, of course, with COVID-19 and everything like that. So more severe and more complex, but they kind of had something to go off of. Do you think that kind of, you know, tied into it to where they can kind of like further those studies? It's not just like, oh, new pandemic, like new situation. So I think that ties into it as well.
For sure. And it definitely helped with treatment too, like seeing, okay, we used antivirals in the other one, let's try to see if we can use the same ones. But in regards to COVID-19 is the disease that comes from the SARS-CoV-2 virus, which is the one that we saw emerging in late 2019. And so by January of 2020, we had already been able to isolate that virus and study its genetic sequence in a lab, so that we knew, okay, this is, you know, the part that codes for the spike protein. And that's how we were able to kind of move along and find that it was the spike protein of how it was going inside of, you know, our bodies. And so we use that information to kind of isolate and start working on the vaccine. So everything kind of came together in regards to other vaccines. Like in 2001, I believe, or 2003, we had the SARS outbreak, which is another coronavirus. And then we had the MERS outbreak, which is also another coronavirus, in the late 2000s. And so we've had other coronaviruses, that have outbreak, and every year we have many variants of coronaviruses. Most coronaviruses are actually very, very weak, and so we don't talk about them in medicine. We just refer to them as the common cold. We'll say, oh yeah, the common cold. We don't even test for them most of the time. We're just like, okay, it's just mild symptoms, I'll get better, and we move on. But these viruses, the one that caused COVID-19, you know, it kind of started alarming the world because of the severe respiratory distress it started causing in people. And then with more and more time, you know, doctors started freaking out, seeing the strokes in young people and all of the, you know, just severe manifestations that the virus can have. And so,
and I wish I had the information with me here, but I don't know. I think it was like when everything started, because it hit home for me. It affected. I had you know, immediate family members who are affected by this. Of course, as everyone has had someone close to them affected by this or themselves. So I just, you know, of course, people go and they read and they want to know more, you know, as it goes along. And I kind of did some reading like back in, I think it was the article I read was like dated back in like the 60s. And
Mhm.
it was something in regards to, it was a strand of, COVID, but it really affected more of like the elderly. And I think it was more of like a respiratory thing, but it was just pinpointed for like more of the elderly. There were just like a few cases that, like I said, it wasn't anything widespread. But they did, recognize it as COVID. And for that, for me, like that was the first thing I saw. And I was like, oh, okay. So this isn't really anything, relatively new. The strain, of course, and how it, like you just said, they recognized and, were able to pinpoint, what was different about it and like what they were dealing with.
Yeah.
But I just found that very interesting that it went back as far as that, to be something, that people suffered from, just maybe not, as severely. So, and I think that even then they were, very curious and like didn't know what to do with those cases. They had a few remedies, some things that worked, but again, they weren't, 100% sure that this was, something for everyone or something that would work, to cure all of the strands that were going on then. So,
Yeah, each one's different. So again, the SARS-CoV-2 was new. Every
mhm,
time there's a new coronavirus that they find, they call it novel coronavirus.
mhm,
And that virus itself, the SARS-CoV-2, is what causes the COVID-19. COVID-19 is just the disease manifestation, so the clinical manifestations of what that virus causes. That's what the doctors, refer to as the disease that the virus causes.
got it.
Um, so kind of like you can compare it to like HIV is the virus and AIDS is the severe form of what that virus
Mhm,
causes.
mhm,
But this virus we didn't know it existed until 2019. Other coronaviruses, I mean, there's been many throughout history, but this one that has affected our world the way that it has is we weren't aware that it existed ever
mhm.
before until 2019, the end of it.
Okay. Got it. So we are going to, you have been so informative. I appreciate all the information. I am wanting to pinpoint two other things and we're going to wrap up here. But
Okay.
if you don't mind just telling everyone the different side effects that they could probably expect after receiving the vaccination, because I know a lot of people may be alarmed by that. They're like, oh, am I, getting sick or, what's going on? So are there just side effects that they should expect to see, and how long will these probably last?
So usually they should be gone. Most people say that within, 10 to 12 hours of them experiencing those symptoms, they
Okay.
they get better and the symptoms go away on their own.
Okay.
And for um for all of the vaccines, it's basically just the symptoms you get are from your immune system just being kind of activated. And
Mhm.
it's similar to, because your immune system's kind of acting up and in action, it releases inflammation responses that that are throughout your body. And so those inflammation responses start giving you, a general feeling of tiredness. You can have body aches, especially where they injected you. You have,
Mhm.
muscle aches there. Some people have fever, chills, muscle aches,
Mhm.
and other than that, I mean, I think just general inflammation responses. I mean, some people do report joint pain. I
Mhm.
actually have a little bit of joint pain in my
Mhm.
knees, um, numbness
Everyone's
or
body is
tingling.
different. Yeah.
Yeah, it varies, and sometimes too. I think for me, I got my vaccination in December, and so I was excited to get it, but since this is new technology, it is okay to feel like, oh my gosh, what's gonna happen? And so you do have a little bit of anxiety
Yeah.
associated with it. And so I